Okay, today we are going to understand some very basic clinical tests regarding your deafness. You might have seen some questions related to this, and it's definitely a NEETMDS topic. Okay, the question is very clear. Middle ear deafness can be tested by now. It's very specific, middle ear. Okay, so we'll understand the different types. These are the options. Okay, you have got a Babinski's test, you have got a Shostak's test, you have got finger nose test and Weber's test. Now this is a very clear example of the question where if you know other options, you can easily arrive at an answer. Okay, even if you don't know exactly what this question is asking about. Okay, because Babinski's test and Shostak's test, we'll come to that. This has nothing to do with your hearing. And even your finger nose test, which I don't know if you're very familiar with that, but the other two you're very familiar if you have learned it properly. Okay, so the answer is Weber's test. Okay, but yeah, I'll come to that, the details and what exactly is meant here. Okay, let's understand the concept. So basically, to understand this, we have to understand that there are two main different types of, or two types of deafness. Okay, where you have to understand that there is a conductive deafness and there is a sensorineural deafness. Okay, conductive deafness and sensorineural. So conductive means basically the problem is in your external ear or middle ear. Okay, so it's basically your external or middle ear, and it is basically about your conduction, that is transmission. Conduction, that's a roadblock. Okay, simple example to understand or analogy to understand is a roadblock in there. Okay, that's what is conductive, and please note the term, the words there, that is external or middle ear. When you come to sensorineural, now it's again something related to your sense of hearing, your neuronal problem. Okay, so and the location is also different, inner ear. So this you can see it's like a cochlea. Okay, so inner ear, cochlea and your nerve. Okay, something related to nerve, brain and all those. Okay, inner ear, cochlear structure, or your vestibulocochlear nerve, or your even in your sensory neural circuits. Okay, so this is a picture which gives you very clear understanding. So the basic problem in conductive deafness is your outer and middle ear, whereas when you come to your sensorineural, it's your inner ear, your hair cells, your cochlea, the vestibulocochlear nerve. Okay, I hope this is very clear. Okay, so again, let me tell you, the correct answer is Weber's test for understanding this particular type of, or to understand the middle ear deafness. So we came across your middle ear, and or I would say outer middle, which is conductive, and your inner ear, which is your sensorineural. So your middle ear, or whatever your conductive middle or outer ear, it's your Weber's test. Okay, let's understand this Weber's test a little bit. So basically it's a tuning fork test. You can see a tuning fork here. Okay, so a tuning fork test to help distinguish between conductive and sensorineural. So now you know what is conductive and what is sensorineural. There is no confusion. Basically a tuning fork test. Okay, let's dwell into a little bit more details to understand what exactly it is. Now it's telling now a little bit details. Okay, just understand, because as it's asked in the exam, let's understand this, how it is performed. So you take a tuning fork, okay, vibrate it, okay, and you just place it at the center of forehead, okay, or your skull, and ask the patient which ear do they hear the sound. Okay, is it in your affected ear or in your normal ear? Now that's a wonderful question, isn't it? So what is the answer you're expecting? Because when you're asking a question, the patient will definitely say that what is he asking? I said him that this is a problem in my right ear. Okay, why is he asking me this? But that's the twist, and that's your surprise to understand here. Okay, so now here, in case of conductive deafness, the sound is perceived louder in your deceased ear. Okay, now this is funny. You are louder in your deceased ear. Now on the other side, sensorineural, it's the opposite. Okay, it's louder in your normal ear, because there the problem is neural. Okay, the nerve is not functioning properly. Here the conduction is affected. So what exactly? Okay, here you will understand a little bit of pathophysiology of your conductive nerve deafness. Okay, so here it is. We said it's a problem with conduction. So for example, you have something blocking this ear. Okay, you have wax or some foreign body blocking this. So what is happening? Okay, there is no air entering. Okay, see, use it somewhere, you hear multiple voices, isn't it? Your air entry, your different sounds around. Okay, so what if that is blocked completely with something here? Okay, no air is entering, so that means your sound from your tuning fork from the top hitting on your skull will directly come and hit. There is, there's a whole bone through, isn't it? So this will actually vibrate these bones, okay, and this will directly transmit here. So this area is blocked, so this you are hitting on the top of the skull and you are conducting it here, okay, directly. So this will become a much more louder voice because this area is blocked to accept any other voice from outside. Okay, no voice from outside, it's directly a kind of bone conduction, okay, and no conduction through the outer and middle ear, okay. So that's one thing. Now here what is happening? Here there is no conduction at all, isn't it? Whatever comes from up top, down below, there is problem with your nerve signals or cochlea or hair cells or whatever. So your affected ear might not function properly, whereas your normal ear will be functioning better. Now just for you to understand some other names of some other hearing tests, okay, a little bit of expansion of your knowledge here. Okay, just know it. Okay, there are 3 tests which you have to keep in your mind, and one of the other common tests used, one of which is Rinne test, okay, R-I-N-N-E, okay. Then you have got this Schwabach test, okay, Schwabach test. So this Rinne test, it is done closer to your ear, okay, the tuning fork is closer to your ear. Schwabach's test and audiogram. Now audiogram is the gold standard, okay. No need to go into too much of details, but just know this, okay. Rinne, Schwabach and audiogram. Rinne, Schwabach and audiogram, and your Weber's test, okay. Now let's come to the incorrect options, why A, B and C are wrong. Okay, let's understand why they are not the tests for hearing. Okay, so this test has nothing to do with your hearing, and it's a kind of neurological examinations, little bit. Yeah, calcium also involved. Okay, let's come to the first test, which is your Babinski's test, okay, which involves your stimulating your sole of your feet, okay, or foot, whatever. You just use something and just stimulate this area there, okay. And what happens now? It says about what? Okay, basically, okay, before that, let's see, a positive response means, your thumb goes like this, okay, to upwards, and the other fingers will be going on to the opposite side. Only thumb will be having an backward or upward pull, okay. The rest of the fingers will be in the other side, whereas negative means, so positive is what is indicative of a lesion, which I'll come to that, okay. Your negative is that all your fingers will be pointing outwards, okay, and whereas here the thumb is inward, the rest is outward, okay. So what is it indicative of? So basically it's a test for upper motor neuron lesion or corticospinal tract, okay, something from your cortex to the spinal cord and not beyond that. That is what your upper motor neuron. Beyond your spinal cord is what your lower motor neuron. So corticospinal, from the cortex of your brain and spinal cord connection, okay. So it's your upper, so it's a positive test indicating that it's a lesion of your upper motor neuron, okay, or your corticospinal tract to be specific, okay. More details on this related to the topic which we will be discussing, okay. Now again, Shostak's test, again not related to hearing. So what exactly it's used for? Shostak's test, some of you might have guessed now itself, okay. Basically what it does is it taps the facial nerve on your cheek in front of, they say that 2 centimeters in front of your cheek, you just tap, okay, with your fingers. So what's happening? Okay, basically when you do this, it's a clinical sign used to test hypocalcemia, that is decreased calcium levels, okay. Basically what happens is that, so when you do this and you see that there is hypocalcemia, there is facial muscle twitching, because calcium is required for your normal muscle conduction, so it becomes abnormal, very simple, okay, in simple terms, okay. Again, this is all a topic which is not related, I'm just explaining it to give you a connection about it, okay. Basically Shostak's test, hypocalcemia, okay. Now finger nose test, now another, again not related to your hearing, another classic neurological test, okay, screening test for an which is not an audiological one, okay. So what exactly, again it's a finger nose connection. Just remember these two words out there. Okay, finger nose test. So basically, a finger nose test assesses the cerebellar function. So basically, cerebellar is your coordination of your movements, isn't it? Are you something related to your ataxia and all? Again, not directly related here, but just to give you, basically it assesses your cerebellar function. Okay, you ask your patient to touch his nose, then ask you to touch your finger. Okay, so this, if he can't do, there is a cerebellar problem. Touch his nose, finger, using a finger, and then touch your finger. So if the patient is not able to touch your finger at the correct position, then there is a cerebellar problem. So finger nose test, cerebellar function. To conclude, middle ear deafness can be tested by, this is what you learned today. Okay, and the answer is this tuning fork. Just remember this. Okay, it's your Weber's test. Babinski is your palms. Okay, Schwersticks is your facial nerve. Okay, and hypocalcemia, Babinski's corticospinal tract. Okay, or upper motor neuron lesion. Chostek's test is something related to your, stimulating your facial nerve, and hypocalcemia, finger nose test, your balance, your coordination. Okay, and Weber's test, your tuning fork test. So that's it for today. We'll have some other discussions, okay, in the next session.